Hello, 209 Times. I am here today to basically talk about asthma today. So we know that asthma is reoccurring cases here in the 209 Times, and a lot of people have been asking the same questions. What can we do? How can we avoid it? And in the case of an emergency, what should we do? So I am here with a couple experts from Delta College that are going to tell us a little bit about the insights, educate us, and also explain a little bit more about asthma themselves. Stella, causes. What can cause asthma? Please take the floor and let us know.
So, asthma is a chronic lung condition that causes inflammation and narrowing of the lungs. The exact causes of asthma are not fully understood, but several factors are believed to contribute to its development and trigger attacks. Genetic factors, family history of asthma. Individuals with family history of asthma are more likely to develop the condition. Gene mutations. Certain gene mutations may have been linked to an increased risk of asthma. Environmental factors, we cannot forget about those. Allergens, exposure to allergens such as pollen, dust mites, pet dander, and mold can trigger asthma attacks. Air pollution. Inhaling air containing pollutants such as smoke, vehicle exhaust, and industrial chemicals can irritate the airways and worsen asthma. Respiratory infections, viral or bacterial respiratory infections such as the common cold and flu can trigger asthma attacks. And exercise. In some individuals, physical activity can trigger asthma symptoms. Other factors would include obesity, stress, and hormonal changes. It is important to note that not everybody with asthma has the same triggers. Identifying and avoiding individual triggers can help manage asthma symptoms and prevent attacks. Nancy here will tell us more about the signs and symptoms of asthma. Thank you.
Yes, so it is very important to recognize the key clinical features of the signs and symptoms of asthma. The most frequent signs of asthma are wheezing, which are high-pitched whistling sounds, shortness of breath, especially with exertion, chest tightness or pressure, persistent cough, usually worse at night or early morning. Episodes do come and go, so it kind of varies on severity. Again, often worse at night or early morning, and we do improve with inhaler or asthma medication. And then also for medical emergency, some of the severe and worsening symptoms would be shortness of breath, unable to speak full sentences, noticing bluish lips or fingertips are also called cyanosis, chest retractions, and efforts to breathe, rapid heart rate, heartbeat, and restlessness, and also fatigue, confusion, and exhaustion.
There are some diagnoses to determine if you have asthma symptoms. One of them are blood count. Your provider can look into the IEG and eosinophils blood levels. If they're elevated, they are certain for asthma. There is a spirometer. This is common lung function test that measures how well air flows through your lungs. A chest x-ray or CT scan can also help your provider look for the causes of your symptoms. And then also a peak flow meter. This measures how much your airway is or restricted during certain activities. These are some of the diagnoses that your provider can use to treat asthma symptoms and diagnose you for asthma.
So we have Ethan here that will tell us more about exhaustion.
Thank you, Nancy.
Severe asthma attacks can be life-threatening. Work with your doctor to determine what to do when your signs and symptoms worsen, and when you need emergency treatment. Signs of an asthma emergency include rapid worsening of shortness of breath or wheezing, no improvement even after using a quick relief inhaler, shortness of breath when you are doing minimal physical activity. If you have frequent coughing or wheezing that lasts more than a few days, or any other signs or symptoms of asthma, see your doctor. Treating asthma early may prevent long-term lung damage and help keep the condition from getting worse or over time. If you know you have asthma, work with your doctor to keep it under control. Good long-term control helps you feel better from day to day and can prevent a life-threatening asthma attack. Contact your doctor right away if your medication doesn't seem to ease your symptoms or if you need to use your quick relief inhaler more often. Don't take more medication than prescribed without consulting your doctor first. Overusing asthma medication can cause side effects and may make your asthma worse. Asthma often changes over time. Meet with your doctor regularly to discuss your symptoms and make any needed treatment adjustments. To determine the effectiveness of the plan of care, evaluation must be performed. The following must be evaluated: maintenance of airway patency, absence reduction of congestion with breath sounds that are clear, noiseless respirations, and improved oxygen exchange, verbalized understanding of causes and therapeutic management regimen, demonstrated behaviors to improve or maintain clear airway, and identified potential complications and how to initiate appropriate preventative or corrective actions.
Then do you have anything else to add, Micah?
Some of the nursing managements are to assess lung sounds for any wheezing or diminished sounds. Set the patient up in high focus position to promote better breathing. Monitor oxygen saturation. Observe for any signs of fatigue, restlessness, shortness of breath, confusion, accessory muscle usage, and changes in skin color. Also, administer oxygen as ordered. Administer prescribed medications such as bronchodilators, corticosteroids, and anticholinergics. Try to reduce any anxiety, teach proper inhaler usage, and educate the patient to avoid any triggers.
Wow, guys, thank you so much. I didn't know there was so much education and information about these things in the 209 times. Now I know next time I see someone with asthma, I know what to do. Just to let you guys know, if you're in the 209 times, there's some sites that we have here that could help people with asthma. We have the Central California Asthma Collaborative, which basically helps to improve asthma management by reducing home triggers and ensuring proper medication usage. We also have the San Joaquin County Asthma and COPD Coalition, a network of organizations working to improve asthma care in the region. Its office is located in 420 S. Wilson Way, Stockton, California. So I am here with my good friends, Ethan, Nancy, Estella, and behind the camera we have Micah. Okay, so I am here with Ethan. Thank you guys, and I hope. Alright, you gotta go with it. Thank you guys. I was here with. Wait. You can cut all of that. You can call it.
We're gonna keep this, and we're here with.
So 209. Stay out. Wait. Hold it.